So we will start with the topic amoebiasis. What is amoebiasis? Amoebiasis is nothing but it is a protozoal infection which is affecting our intestine and liver, and it is caused by the causative agent which is nothing but the एंटा histolytica. ठीक है, तो आपको ये रिमेम्बर करना है कि अमीबियासिस किससे होता है? एंटा हिस्टोलाइटिका. ठीक है, which is transmitted through fecal oral route. Now, what is there? The trophocytes which are formed. Okay, this enters the bloodstream. And जैसे ही वो bloodstream में enter करता है, वो क्या करेगा? Affect करेगा हमारे liver को. Okay, and वो क्या cause करेगा? Liver abscesses. अब liver abscesses is nothing but swelling of the liver and also the pus formation. तो अगर हम symptoms की बात करते हैं of amoebiasis, so we can see diarrhea, bloody stools, मतलब dysentery होता है. Okay, then fever is there, abdominal cramps are there, ठीक है. But in case of severe amoebiasis, there will be liver abscesses. As I told you, liver में swelling होती है plus pus formation भी हो सकता है. ठीक है. Now अब हमें amoebiasis को treat करना है, तो obvious सी बात है, हमें anti-amoebic drugs यूज करनी पड़ेगी, जो उस causative agent that is nothing but the anti-amoeba histolytica के against effective होंगी. ठीक है. Now we will see the classification. Now this classification is very important, okay, to remember, because यहाँ से आपको direct question पूछता है. So now we'll see the classification. Anti-amoebic drugs जो है, they are divided into two: tissue amoebicide, luminal amoebicide. Okay. Now in case of tissue amoebicide, they are further classified as for intestinal and extra-intestinal amoebiasis. And यहाँ पर for extra-intestinal amoebiasis only. तो फर्स्ट हम लोग देखते हैं ये वाला फॉर दी इंटेस्टिनल प्लस एक्स्ट्रा. नाउ इंटेस्टिनल इज नथिंग बट जो अमीबियासिस हमारे ल्यूमेन या इंटेस्टाइन को अफेक्ट करते हैं. एक्स्ट्रा इंटेस्टिनल मतलब क्या होता है? समथिंग रिलेटेड टू दी हेपाट, या बोल सकते हैं हम लीवर. ठीक है, जब हमारा अमीबल इन्फेक्शन जो होता है हमारे लीवर को इफेक्ट करता है, ठीक है, उस केस में भी आर टेलिंग इट एज एक्स्ट्रा इंटेस्टिनल अमीबियासिस. Then we will see the next nitroimidazole and alkaloid. So these are the drugs which are used for the treatment. Now, if I'm talking about alkaloids, you have to remember, and this is very important. ये पूछेंगे कि एमेटीन, डिहाइड्रोमेटीन, ये कौन से बोल सकते हैं कि alkaloids है या anything. Question can be coming from anywhere. So you have to rectify the classification, or if you understand it, it's well and good. ठीक है. Then we'll talk about nitroimidazole. These are the very important, class of the drug for the treatment of amoebiasis. They are metronidazole, tinidazole, secnidazole, ornidazole, cetronidazole. Okay. Then we'll come to the most important one is nothing but the extra intestinal amoebiasis only. मतलब ये वाला जो ड्रग है सिर्फ मेरे हेपेटिक या बोल सकती हूँ मैं लीवर एमीबियासिस के लिए ही मैं उसको यूज कर सकती हूँ. ओके. So you have to remember the drug is nothing but the chloroquine. You know this chloroquine is also an anti-malarial, right? It is an anti-malarial drug or not? So it is used in the treatment of extraintestinal amoebiasis also. Then we talk about the amides. The examples are diloxanate furet, nitazoxanide oxide. Antibiotics here are tetracycline, paramomycin. Okay, and these are 8-hydroxychloroquine, hydroxychloroquinose, quinidochlor, iodoquinone. Then we will see about the life cycle, okay, of amoebiasis, how it is occurring. So this is what. This is my intestinal lumen, okay. Then inside these are cysts, okay. So these cysts cyst passes. If what happens in this case, if this like in the form of trophozoites, okay, it erodes your intestinal walls. If I say if it erodes his one second. If it erodes its intestinal wall, obviously it will lead to the formation of ulceration. Okay, it will lead to the formation of ulcer. The similar, this are nothing but the cyst, or we can call it as trophozoites. Now, these trophozoites enter in the bloodstream. Okay, it enters in the bloodstream. It may cause ulcer also. After entering in the bloodstream, then it enters the liver. And once these trophozoites enter the liver, it is going to cause liver abscesses. Okay, that is nothing but the pus formation. So this is nothing but the life cycle of how the cysts enter in the blood or in the intestinal lumen, or we can say trophozoites, and then these trophozoites enter the blood, and then from the blood it enters into the liver, where it can cause what, hepatic or extraintestinal amoebiasis or liver abscesses formation. Then we will see on the individual drugs. First is the very important drug, which is nothing but the metronidazole. Okay. So this metronidazole, it is the prototype of nitroimidazole class of the drug. Okay. It has broad spectrum activity against Giardia lamblia. Then we have to say metronidazole is selectively toxic to anaerobic and microaerobic microorganisms. So this point is very important, which I have highlighted. Okay. Then we will see the mechanism of action of metronidazole. Okay. Now, if you see the structure of the metronidazole, you may see there is the presence of imidazole, nitro group, NO2 group, ethanol group, methyl group, right? So the NO2 which is present, this NO2 which is present. So first you have to see the mechanism of action, right? So here you just see metronidazole enters the cell by diffusion process. Then the redox proteins. So what happens once it enters into the cell? Now this NO2 is there. Okay, NO2 present in the structure. This gets reduced. This gets reduced by the reducing or redox proteins. And this further, it leads to the formation of, we can say, reactive radical. And this radical is very toxic to the DNA. Okay. And if it is toxic to the DNA, obviously what it will do, it will lead to the DNA deformation, or it will lead to the DNA breakage, you can say, breakage of the DNA strands. Okay. So this is the mechanism of action of metronidazole. And it is very important. You should remember it. Then we come to the pharmacokinetics. Fine. So we'll talk about the pharmacokinetics. Metronidazole is almost completely absorbed from the small intestine. It is widely distributed in the body, attaining the therapeutic concentrations. Metabolism occurs in the liver by oxidation and glucuronide conjugation. Okay. So you remember this thing. The metabolism is nothing but it is occurring due to the glucuronidation or glucuronide conjugation, which is nothing but a phase 2 reaction. It comes under phase 2 reaction, right? Then, if we talk about adverse drug reaction, okay, we are talking about adverse drug reaction. So, it is not very serious. You may suffer from anorexia. Metallic taste is very important, which I have bolded. Okay, abdominal cramps are the most common. Okay, so you can remember it as like this: M say metronidazole and M say metallic taste. So this is how you can recall your side effects or adverse drug reactions. Okay. Then less frequent side effects which we see are headache, glossitis. Glossitis is nothing but inflammation of the tongues, dryness of mouth, impairment concentration, or you feel a difficulty concentrating on some aspects, right? Thrombophlebitis of the injected vein occur if the solution is not well diluted. Then we'll talk about the contraindication. So where is this contraindication? मतलब metronidazole को हमें कौन से केसेस में नहीं देना है, ठीक है? So the metronidazole is contraindicated in the neurological disease and the blood dyscariasis. Okay, and also we are not giving it in the first trimester of pregnancy. Also, this is the important point which I'm highlighted or bolded. It is cautious to use in chronic alcoholics. Why? Due to the disulfiram-like reaction. Okay, and in case of disulfiram-like reaction, we suffer, or you can say symptoms such as nausea, vomiting, abdominal cramps, headache, flushing will occur in such patients if you are consuming metronidazole, and in the patients who are already alcoholic or who consume a lot of alcohol. Okay. Then we talk about the uses. So uses, as we know, it is used in the treatment of amoebiasis, giardiasis, bacterial vaginosis, pseudomembrane colitis, used in the treatment of H. pylori infection also. Okay. Then it is used in combination with clarithromycin and amoxicillin and a proton pump inhibitor. Okay. It is also used to extract guinea worm, also used in the treatment of Crohn's disease. Now we'll talk about the drug interactions of metronidazole. Now metronidazole is potentiating the anticoagulant effect of warfarin. Means if metronidazole is given along with the anticoagulant, okay, what will happen? The effect is potentiated. Okay, potentiated effect is seen. Why such? We will see. And other oral coumarin by inhibiting their metabolism. Now what happens is metronidazole inhibits the metabolism of the anticoagulant. मतलब metronidazole क्या करता है, जो anticoagulant drugs अगर हमने कंज्यूम किया है, और मैंने metronidazole भी लिया है, ठीक है, metronidazole एंटीकोगुलेंट ड्रग का मेटाबॉलिज्म होने से रोकेगा. अगर समझो मेटाबोलाइज हो गया तो मतलब एक्सक्रीट आउट हो गया, पर अगर मेटाबॉलिज्म नहीं हुआ किसी ड्रग का बॉडी से तो क्या होगा, उस ड्रग की कॉन्सेंट्रेशन बॉडी में बढ़ जाएगी, राइट? तो मेट्रोनिडाजोल क्या कर रहा है, जो एंटीकोगुलेंट है ना मेरा ड्रग, उसका एक्सक्रीशन बोल सकते हैं, मेटाबॉलिज्म बंद कर रहा है. और जैसे मेटाबॉलिज्म थोड़ा सा इनिबिट कर देता है तो क्या होगा, मेरे जो एंटीकोगुलेंट है ड्रग, उसका इफेक्ट मेरे बॉडी में, उसका कॉन्सेंट्रेशन बोल सकते हैं बढ़ जाएगा. ओके, सो इसीलिए हम बोल रहे हैं पोटेंशिएटिंग द इफेक्ट ऑफ वारफरीन. इट में पोटेंशिएट लिथियम टॉक्सिसिटी by decreasing the renal clearance of lithium. Obvious सी बात है, अगर lithium का renal clearance आप decrease कर रहे हो तो it will get accumulated in your body, lithium, okay, and it will lead to the lithium toxicity, right? Then other drugs of this class are tinidazole, secnidazole, ornidazole, which we have already seen. Okay. Now we'll come to the emetine. Emetine हमारी alkaloid class की drug थी, ठीक है? So now we will see. It is an alkaloid from Cephalus ipica kuhana. Okay, so this is important to remember. It is potent and directly acting amoebicide that kills tropozoites but has no effect on the cyst. Then we have already spoke about the chloroquine. Okay, chloroquine is what? An antimalarial drug hai. It is used in the treatment of extraintestinal amoebiasis, which is also called as hepatic amoebiasis. And इसमें जो main चीज है, आप in the classification I've told you what to remember, and here you have to remember this one thing, which is concentrated in the liver. Okay, so this is the important thing you have to remember. Then come to the diloxanide furoate. It is highly effective luminal intestinal amoebicide. The point I've highlighted is to be remembered. Okay, then the major thing is that this diloxanate furoate जो है ना, this, it is, you can just assume कि when it is metabolizing, okay, it leads to the formation of diloxanate furoate ester, ठीक है, which is further hydrolyzed to form diloxanide, and it is metabolized by glucuronide conjugation. And one more drug I have told you, which is metabolized by glucuronide conjugation, right? The major side effect you can say of the diloxanate furoate is flatulency. That is expelling of the gas. Flatulency is nothing but expelling of the gas. Fine. Then next is the nitazoxide oxide. It is luminal amoebicide. Fine. It is what? It is a luminal amoebicide used orally in amoebiasis and giardiasis. Adverse effects are normal, like headache or GI disturbances will likely to be occurring. Okay. So here that's all. Thank you.